Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday here at East Cooper Medical Center, and today we're sitting down with a Low Country bariatric surgeon to learn about some of the most popular procedures for those looking to lose weight.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Washington. He's a bariatric surgeon here at East Cooper Medical Center. Thanks for being here.
Thank you for having me.
All right, today we're talking about options for weight loss.
Yes.
Right.
So there are several options for weight loss today, both non-surgical and surgical. But we'll go over the surgical ones. So I want first everyone to understand that all of these operations are done minimally invasively. The days of having to make a big incision in the past, such as this, are over. You know, we used to have to make big incisions to do these operations, but now we can do them through tiny little incisions, and we actually insert cameras into your belly to actually do these operations. But what that means is that most patients can go home the next day after these operations, whereas prior they were in the hospital for a week recovering from the surgeries. So the minimally invasive using cameras inside the belly has been a very big advantage to doing weight loss surgery.
So are you having to be in there like moving all these tools like a video game type deal when you're in there?
It's somewhat like a video game.
Gotcha.
Yes. But the benefit is remarkable. Patients get up, 2 or 3 hours after the operation and walk around and feel pretty good, maybe just a little bit sore, whereas prior they could, had needed like help to get out of bed and could hardly move.
Could get infections and stuff like that.
And of course it decreases because the wounds are so small, they rarely get infected.
All right, so what's the first process or procedure that you want to talk about that's available? Here, I can grab these for you.
Sure, thank you. Well, the first one I'm going to talk about is the gastric bypass. And the gastric bypass has been done the longest in the United States. And many people feel it is the gold standard to which we compare all other operations. It's kind of fallen out of favor a little bit because we do have newer operations called the sleeve gastrectomy that's kind of taken its place. But just briefly, the gastric bypass creates a little pouch. We connect the intestine to the little pouch and reconnect it here. And how it works is when you eat, this little pouch, which is only a fraction the size of your normal stomach, it makes you feel full faster, and as it passes down the intestines, it creates a little malabsorption of your food.
So what's the success rate? I mean, with this particular one?
Gastric bypass patients on average lose between 60 and 80% of their excess weight.
Wow.
So it's very successful when you compare the weight loss drugs, which are like, 10% of your excess weight, and diet and exercise, which, maybe you'll get off 5 to 10% of your excess weight, but most patients regain it. So these operations have been the only proven long-term weight loss success, the only thing that's been proven to work.
But also, this is a lifestyle change, right? Because you can't just get it and then think you can go back to.
Well, it's I look at obesity as a lifelong illness. Okay, it's not that we're going to do these operations and miraculously that you're going to be free of obesity for the rest of your life. We know that it takes patients to follow up appropriately and be involved, okay, and follow their dietary and behavioral modifications to have long-term success. And because of that, we have a comprehensive program here at East Cooper, okay, which is going to entail having support groups, okay, which meet once a month that we encourage our patients to attend to keep them motivated and to keep them involved. They say when you do bariatric surgery in a vacuum, patients can regain the weight.
Yeah, so that's really cool that y'all are doing that. And this is a new program here anyway. So I think having a support group probably does a lot of good for this.
Exactly, and I attend every support group.
Wow, okay. All right, so what's up next here? I'll grab those from you.
So then, the lap band, okay, which is not done as much anymore, but I still think it has a place for the lower BMI patients. And this is actually
pulling out all kinds of stuff.
This is actually the band itself. It's made out of silicone. It goes around the upper portion of your stomach. It's adjustable. It has a little port that's under the skin that we can access in the office with a needle and inject fluid in it, and it makes it a little tighter around your stomach. Or conversely, we can withdraw fluid from it and makes it a little looser around your stomach. It is a very safe operation that can be done ambulatory. You can have this operation and go home the same day. It is one of the safest bariatric operations, but I think it works the best in, like I said, the lower BMI weight class of people that maybe their BMI is between like 30 and 35, or roughly have maybe 50 pounds to lose.
Gotcha. So how long can this stay inside you?
This can stay forever.
Forever?
Forever.
Oh, wow. Okay. All right, so we have another one coming up, right?
Right. The sleeve gastrectomy is the newest of all the operations. And the sleeve gastrectomy, basically what you do is you take a stapler and you staple up and you make your stomach, instead of being like a large sac, a thin tube. It is the most common operation done for weight loss surgery today. And it works because it removes the hormone that we had spoken about earlier called ghrelin. Ghrelin is that hormone that maintains your set point, and when you lose weight, your ghrelin levels go up to make you eat more. Okay, but by removing a large portion of the stomach, we remove the ghrelin is produced in the stomach, and we remove a large portion of the ability of the stomach to produce that hormone. So patients really like this operation because it really decreases their appetite significantly. And then because their stomach is smaller, they'll eat appetite-sized portions. But since they're not that hungry to begin with, they're very satisfied with that. And we get very good weight loss results from the sleeve gastrectomy also.
How long has this been around?
This is probably, the sleeve gastrectomy has been done for probably 10 years now.
Gotcha. Alrighty. Now, what's our next one? I see we have a fun little device over here.
Now, we have the gastric balloon. And the gastric balloon, like I said, was done for a long time outside of the United States, but it's been introduced in the United States for the last 3 years. It is a non-surgical weight loss option. It's put in with a scope. It's deflated when it goes in, and then when we get it inside of your stomach, we pump saline, which is just a little salt water, into it and inflate it to the size of maybe a small grapefruit.
I'm like, I gotta hold on to this.
Right. It lies in your stomach like this, takes up space, and fools your stomach into making you feel as if you've just eaten. Right? This is not permanent though, however. It can only stay in for 6 months. And because of that, it's mainly made for the people that are in the lower BMI range, maybe 30 to 35, maybe 40. Okay, who need just a little kickstart to give them incentive to keep the weight off. So we can put this in, and then at 6 months it's taken out endoscopically, and then you have to try to do it on your own.
Oh, wow. So, and food can pass through there and stuff
food can
easily?
pass through it. This is an ambulatory procedure. It probably takes 15 minutes to put in. You're probably in the hospital altogether, maybe 2 hours, and then you go home.
All righty. Anything else the folks at home need to know? Before we go, like, you're a new doctor in town, right?
Right, I'm a new doctor in town, and we're starting a new service line here at East Cooper Medical Center, a new comprehensive bariatric program to serve the community in Mount Pleasant.
Exciting stuff. All right, well, thanks again for having me. And for more information, head online to eastcoopermedctr.com.